Assalamualaikum and good morning, Abid to my partner and intended audience. My name is Hanis binti Muhammad Yusni with matrix number AS11561, and here is my partner Nur Farzana binti Hasmi with matrix number AS11565. Both of us are students at University Putra Malaysia. Nowadays, many healthcare managers are working to effectively utilize social media to engage patients and consumers. Organizations in the healthcare industry have been able to shift away from conventional advertisement approaches and toward the use of internet to communicate with patients through effective marketing and communication strategies. Today, we are going to tell all of you about the reasons why health communication via social media is effective in educating the public. We believe that since we are all exposed to social media on our daily basis, this health-related knowledge is one of the most common knowledge we see in advertisement or on platforms such as TikTok or Facebook, where we believe it can easily raise awareness among the public. We are going to divide this presentation into three main sections where Farzana will explain on the first and the third reason, whereas I am going to explain on the second reason why social media becomes an effective platform in educating the public about healthcare. So now I'll pass to Farzana to continue the presentation.
Thank you, Hanis. So, my first point would be crisis situations. In moments of crisis, social media has proven to be an incredibly powerful platform for delivering updates to users in real time. During natural disasters or pandemic outbreaks, hospitals and other healthcare agencies can quickly update their social media networks on hospital capacity, service statuses, and emergency room access. A good example would be when a natural disaster struck Japan in 2011. Doctors regularly use Twitter to keep their patients up to date. In addition, the Centers for Disease Control and Prevention use social media networks to inform the public about the H1N1 virus in 2009. Furthermore, social media allows healthcare workers to share updates released from organizations such as Red Cross, WHO, and the CDC, as well as communicate with news networks. A new COVID-19 virus outbreak, which began in December 2019, which is caused by infection with the extreme acute respiratory syndrome coronavirus 2 virus strain, has presented a significant obstacle to healthcare providers in terms of limiting its dissemination. Since this was a lesser known illness, healthcare organizations and physicians face a number of specific obstacles. It was critical to raise awareness and prevention information among healthcare providers as well as the general population, especially civilians living in rural and remote areas. They wanted to cut down on the dissemination of misconceptions about medication, risk factors, and preventions. To address this issue, major healthcare authorities switched to social media platforms such as Twitter, Instagram, and Facebook. They were effective in communicating reliable healthcare knowledge to both the medical professions and the general population in a timely manner. So that's all my first point. Uh, I pass this to Hanis for the second point.
Thank you, Farzana. Secondly, one of the reasons that health communication via social media is effective in educating the public is that it can increase patients' access to healthcare information. Research found that in United States, 8 in 10 internet users search for health information online, and 74% of these people use social media. This shows that social media can therefore be a powerful tool by exposing people on the importance of healthcare as well as attract large numbers of people to facilitate greater progress toward public health goals. Nowadays, sharing information about healthcare in internet has become a trend where it gives positive impacts to society because people can easily ask about their consumers in their related healthcare. They do not need to schedule an appointment at a clinic or hospital just to ask a question because the platform offered on social media is more convenient to use and can provide them with the information they need quickly. For example, the social networking site like Patients Like Me provides a venue for patients to access information, suggestion, and support from other people who have the same disease or condition. Facebook groups also frequently focus on specific medical conditions. These groups actively engage in peer-to-peer support as well as fundraising efforts to associate with organizations and individuals. To conclude, using social media to educate the public about healthcare is successful because people have easy access to healthcare information. Now, I'll pass back to Farzana to continue this presentation.
All right, thank you. So the third point will be social media can create peer support between people. The entire point of social media is communicate with others. When someone is going through a traumatic illness, recognizing that there are also other people out there who have been through or are facing the same challenges gives social comfort to the patient. Social support has been shown to improve clinical conditions, with some research indicating that patients' compliances and overall health improve as they receive support from families and friends. Users may use social media networks to explain concerns and inquiries that are addressed by friends or experts. Many online campaigns have soared and proved to be a massive success as a result of social media. Issues such as smoking cessations and weight loss journeys have inspired people all over the world to make healthy lifestyle choices through social media platforms. Furthermore, hashtag promotions on Twitter and Facebook for organ donors and fundraising have assisted individuals in receiving treatments that would not have been able without the use of social media networks. Furthermore, social media tends to open dialogue about mental health problems and sexually transmitted disorder, which helps to minimize the stigma of suffering from such a medical conditions. Since people with such disease are also forced out of insecurity and left to isolate themselves. To sum up, health communication via social media is really effective in educating the public and also giving awareness to the public because social media is important during crisis situations. It increases patients' access to healthcare information and it created peer support in public. Besides, social media use is growing and not likely to disappear. While there are some difficulties in protecting privacy and confidentiality, as well as the security of the information shared on the internet, the benefits to the general public and healthcare institutions outweigh the medium's limitations. Whether you are currently using social media or not, it is important you establish an acceptable social media policy and communicate the policy to all staff. So that is all from both of us. Thank you.
Thank you.